is to realize that the shame is something that is counterproductive to leaving an addiction. Number two, you're not alone. Everybody has some sort of an addiction or the other. Yours just tends to be anything that is much more taboo, doesn't make it much different. And number three, there is a lot of help on this, and you're not the only person that has walked in these shoes. Many people have, everybody does. So reach out for help.
So I'm just going to introduce our next speaker. Our next speaker is Dr. Siddiqui, and Dr. Siddiqui is a graduate of the University of Missouri, Columbia program, and a double board certified child, adolescent, and adult psychiatrist. He is an expert in pediatric and adult psychopharmacology. He treats all adult and childhood psychiatric disorders with close to 2 decades of experience. He will be speaking today about anxiety and depression and understanding it as a mental illness.
Assalamu'alaikum. So we have only 15 minutes. So let's find out who are we talking to today. Any psychology students? Most of the people present are computer sciences, engineers. Okay. So I thought we'll take this time to maybe give you just a brief introduction. And I think most of you guys have taken psychology courses or classes at some point. So this may be very basic information, but if we have more time, maybe next time we can go into each condition, more detailed, more technical information. So mood disorders are a group of mental illness in which the cognition and how one feels are involved. There are several types of it. Anxiety disorders are a group of conditions in which the hallmark is fear and anxiety, anticipatory anxiety. So we'll talk about it in detail later. So mood disorders are very common, and unfortunately, we'll talk about male versus female. At some point in life, up to 21% women will go through an episode of major depression or clinical depression. Unfortunately, both mood disorders and anxiety disorder tends to be a lot more common in women than men. In some conditions, in some cases, it's up to 4 times. The only one condition in which the ratio is about the same is bipolar disorder type 1. So mood disorders can be divided into these common categories. So we have, most common condition is MDD or major depressive disorder. And then there's another type, it's called dysthymic disorder, DYS. So I'm going to explain quickly about all of these conditions. So number 1 is major depressive disorder, second one is a dysthymic disorder, third one is premenstrual dysphoric disorder. Then we have some SAD or seasonal affective disorders, and then we have bipolar disorders. So major depressive disorder, female versus men, has about 21% life incident or prevalence. So all of these conditions tend to happen, and a lot more common in women than men. Of course, men do not have this problem, but major depressive disorder is a type of mood disorder in which you have severe sadness and loss of pleasure to the point that you are unable to function. unable to perform your education or occupation. Dysthymic disorder is a chronic low-grade type of depression in which you may be able to continue to perform maybe less than your maximum potential. Dysthymic disorder can last for years without being recognized. Major depressive disorder, you have to have significant symptoms for at least 2 weeks. Premenstrual dysphoric disorder is a type of mood disorder in which women will have severe mood lability. Symptoms of major depression along with some physical symptoms. And this is usually associated with menstrual cycle. And in order to have diagnosis of PMDD, you need to have at least, in the last 5 years, 2 consecutive menstrual cycles with these symptoms, plus significant dysfunction. For example, they can be very depressed, sometimes suicidal, violence can happen, loss of work and functioning. Seasonal affective disorder is when you have clinical depression symptoms which are not present most of the year, but usually the onset is in fall when the days are getting shorter and nights are longer. And usually symptom will resolve at the onset of the spring. So they seem to have, there's a different biology in terms of other conditions. And bipolar disorder is a type of depression in which we have depressive mood episodes. However, in between or accompanied by these depressive mood episodes, we have opposite of depression. You have sustained periods when your mood is either elevated, either you're euphoric or extremely irritable or hostile. And instead of having sadness, isolation, fatigue, lack of drive, lack of motivation, even suicidal thoughts, shamefulness, hopelessness feelings, and guilt, bipolar disorder patients, when they're going through an upswing, we call it mania or hypomania, they have no shame or guilt. They have increase in goal-directed activities. So this is a very serious condition, and unfortunately, without treatment, the person may have serious consequences in terms of their relations, their functioning. So if I have to draw, let's see, this is a baseline. So a major depressive disorder will look more like this. So I'm just simplifying for the sake of simplicity that you have normal euthymic mood, but then you have specific period of time and you start to feel low, sadness, isolation, fatigue, feelings of guilt, rejection, sensitivity, I'm not good enough, low energy. Sometimes people sleep too much, hyperinsomnia, sometimes they sleep very little. And very peak, they can have feelings of helplessness and hopelessness, that things are never gonna get better, and that's where sometimes people have suicidal thoughts. If these episodes last more than 2 weeks, we call it a major depressive episode. And during these periods, there's a traumatic functional impairment. Not able to go to school, not able to go to work, not able to care for your family, or loss of activities of daily living. People don't want to get out of the room, take a shower, bathe, take care of the kids. Bipolar disorder patients, they do go through these low periods. However, sometime in between these low periods, they go through these upswings. So it can be 2 types, mania or hypomania. Mania is an elevated state when people have racing thought, either they're extremely euphoric or they're extremely irritable and angry. It can be either way. However, they have higher energy, they have increased interest in goal-directed activities, and these symptoms must last up to 7 days in order to be diagnosed with mania. So a person who goes through major depressive episodes with manic episodes has bipolar disorder type 1 or manic depressive illness. However, some patients go through these major depressive episodes, but the manic episodes are rather mild. They don't get euphoric, grandiose. However, they may feel depressed and angry, irritable, depressed. They may not have complete lack of sleep. And sometimes they do have increase in goal-directed activities. And this is a milder version of bipolar disorder, and this is called bipolar type 2. So type 2 bipolar patient can be extremely functional and very productive. Most of the writers, and painters, and .com or starters have bipolar type 2. So Elon Musk thinks, he himself admits that he has type 2 bipolar disorder. He says all these ideas come when he's in this state here. He has thousands of ideas in his mind. He's highly creative and energized. So this is how we differentiate between major depressive disorder and bipolar disorder. If I have to pick what does dysthymia look like here, so dysthymia may be that you have a person who has persistently low mood and is kind of chronic, but they're able to go to work, they are able to function without having traumatic dysfunction. This is a very interesting topic. Some people believe premenstrual dysphoric disorder is a made-up condition, and drug companies want to sell drugs. So they came up with this idea. However, this is a really serious problem. Unfortunately, all type of mood disorders of females or women suffer a lot more than men. And I think it has to do with many factors. For example, women have hormonal changes. And I think women suffer a lot more environmental and social stress, sexual abuse, sexual harassment. They become mothers, they have difficulty with exhaustion and taking care of kids. And sometimes all these factors pile up. So I think that's some of the reason why women seem to have all of these conditions a lot more than men, except bipolar 1, which is about 1% in population. Men are about 0.8, sorry, women are about 0.8 and men are about 1%. So with MDD, we have about 21% versus 13 or 12%. So premenstrual dysphoric disorder, the reason it is a serious problem because during these periods, women can be extremely labile, irritable, explosive, and there have been incidents of violence, suicides, and it can be a very serious problem, so it needs to be recognized and treated. SAD is less common. It's still 4 times more common in women than men. How much time I have left?
You have about
5 minutes. So these are the kind of major classes of mood disorders. After major depressive disorder, type 2 bipolar disorder is probably the most common condition we see in psychiatrist's office. Type 1 bipolar disorder patients, this is a very devastating condition and they get diagnosed easily. Type 2 bipolar patients take up to 7 years of psychiatrist treatment, treating them to get correct diagnosis. So this is a problem we see a lot in our office. So I wish we had more time. We can go into more detail in terms of their biology, phenomenology, and how do we treat these conditions. But today we are just going through some of the major types. So we didn't talk about, half of us are female here today, so let's talk about what are the mood disorders which are specific to women. And so we talked about PMDD. Then we have perinatal depression. Perinatal, mood disorder or depression would be, which will include postpartum depression, and postpartum depression can be several types. Then women also has problems, only specific to them is birth control related depression and menopausal depression, perimenopausal depression. Perimenopausal means you start to have some mood symptoms in your mid-40s up to late 50s or even longer. So these are, if we have more time, maybe next time, or if you want to have more questions about these we can discuss. Now, I've taken all the space, I don't have any space left for anxiety. So, in general, anxiety disorders involve similar or same neurotransmitters. A lot of time we end up treating anxiety disorder and depression with similar medications. But the most common type of anxiety disorder will be GAD, which is generalized anxiety disorder, and then you have obsessive compulsive disorder, panic disorder, you have separation anxiety disorder, social phobia. So children suffer from two major types of anxiety disorder. One is separation anxiety disorder, and the other one is selective mutism. Selective mutism is a child, it's rather rare, but it's a very fascinating condition. The child is able to communicate with the nuclear family members only. Outside the home, they don't talk to anyone. And sometimes they do require treatment. Separation anxiety disorder, a lot of time when kids going older, it can be precursor for generalized anxiety disorder. So all of these conditions involve fear and anxiety. Fear of perceived or real danger. Generalized anxiety means this person is highly worried about things which may be normal. However, they worry so much that they have physical symptoms and they have problem with cognition, focus, concentration. Obsessive compulsive disorder patients, they worry about things which are idiodystonic. They don't make sense, but we can't help it. I may have a session about germ, dirt, grime, I may wash my hand 15 times and still feel that there is an illness or germs on my hand. So the OCD requires some type of compensatory mechanism or action to relieve the anxiety. Panic disorder is a sudden, short, it's a brief episode of severe anxiety with severe impending feelings of doom with physical symptoms, chest pain, shortness of breath, dizziness. Majority of these patients end up in ER with a complaint that they may be having heart attack. I think my time is up. So if we get more time, we can talk more in detail, or maybe you guys can have questions. Thank you.
All right, thank you, Dr. Siddiqui. And a reminder that there is a Q&A form on the event page if you have any questions as the speakers are speaking, and you want to remain anonymous, so you can fill that out. As well, in a little bit after Dr. Ghadeer speaks, we're going to open it up for questions from the audience. So I'd like to introduce Dr. Ghadeer Okayli, who's our next speaker. And Dr. Ghadeer graduated in 1997 from the University of Wisconsin. She is an adult psychiatrist here in Austin. She has over 17 years of experience treating adults with a large spectrum of psychiatric conditions like depression, anxiety, PTSD, OCD, bipolar disorder, schizophrenia, eating disorders, and ADHD. And today she's going to be speaking about coping skills and kind of how to deal with a lot of different issues that come up in our lives and what the best way to deal with those is. Thank you.
Assalamu'alaikum, everybody.
Wa alaikum assalam.
I am honored to be part of this panel to hopefully deliver some pearls of wisdom, if I can. But I think what I want to do is try to understand the issues that are specific to college students that they actually deal with that can cause mental agony, and if there are any specific issues to you as the minority group of being Muslims, let's talk about that as well. So I'm going to open up the question, which is, according to your experiences, what do you all struggle with? What are the reasons why you can have mental anguish or agony at your age? Please.
I'm not currently a college student, but when I was, my problem was judging non-Muslims.
Okay.
So growing up only with Muslims and then going to college, the first
Yes.
experience of non-Muslims, I knew that it was wrong. So
Yes.
I didn't proactively judge people, but I knew, I was like, I know I shouldn't be feeling this way, but I have to deal with it.
That's a great one. Let me actually, I'm going to go to the board because now I decided that I can write some stuff. All right. All right, so I think this would be a better color to write with. All right. So there is judgment. Okay. What else? Someone else was. Yes.
Like the vice versa, like not being judged by others.
Being judged by others. Okay, so this can go both ways. Being judged or judging people. What else? I want to see everybody raising their hands. We all have anxiety. We all have mental anguish or agony. It doesn't have to be a disorder, but it could be severe enough to kind of cause a lot of hurt or pain in our hearts. Okay.
Maybe not doing enough.
Okay. So, self-esteem. So, judging yourself, you're not good enough or not doing, you're not working hard enough. What else? Yes.
So, I've noticed, being a master's student, finishing undergraduate, I've seen people with undiagnosed ADHD spiral into picking majors that are easier, they're underachieving, and then going into depression, and then it becomes this big long spiral. So I don't think a lot of people know how to even start questioning, maybe I have severe or minor symptoms of ADHD.
Yes. So they lose confidence. They see
exactly.
that they are
That's
performing under their
well,
potential,
Yeah.
and they're struggling and working hard, but yet they're just not gaining
Yeah,
the fruits of
that
it.
hamster wheel syndrome. Yeah.
The hamster wheel, yes. And so there is the unrecognized mental illness that can play part into causing a lot of mental anguish. Unrecognized mental illness. What else?
I have a problem where I like to help others, but I don't want to help myself. I'm unmotivated to do anything for myself, but I jump at doing something for somebody else.
And how does that cause mental agony for you?
No, I don't achieve.
Okay, okay. So you kind of sacrifice yourself for the pleasure of others. So people pleaser. You want to please people, even if it's at the expense of your own performance or well-being. Okay, so overdoing or pleasing other people, okay? What else? Yes, please.
Building meaningful social relationships. Trying to build meaningful relationships.
Trying to be in meaningful relationships. That causes anxiety for you. Do you have fears of not being able to impress somebody else to be in a relationship or be accepted?
Just like a variety of struggles, and just finding your place, not feeling alone in the crowd, trying to get to know people.
Trying to not feel alone in a crowd and trying to kind of come forth and mingle with people and have some meaningful relationships with them?
Yeah.
I'm like, okay, so there is some anxiety about being in social, how you carry yourself in a social situation where you feel that you are accepted, you're not being judged for certain behaviors or who you are, and you're not also judging other people. So that also comes back to judgment. And that causes anxiety. If you feel like, okay, am I weird? Am I awkward? Am I going to be able to communicate with this person without them judging me or thinking that I don't fit in? And so that causes a lot of social anxiety. And so, anybody else? Okay, please.
Coping with death.
Coping with death. Okay, so loss. Death or any kind. Of course, death is the severest form of loss, especially if it's death of somebody who's close. And so we have talked about a few things that agonize all of us. All these things happen normally every day. We deal with people every day. We have family members, and they go through pains, and we have to grieve, trying to help them or trying to, if we do lose them, trying to see how we can actually live and survive after their absence from our lives. So mental agony is caused, who thinks mental agony is caused by feelings? Or is a feeling, actually? Raise your hands if you think mental agony is a feeling. Okay? Okay? Okay. A few hands. Who thinks that mental agony is a thought?
Is that equivalent to state of mind?
Pardon?
Is a thought equal to state of mind?
Yes, anything that's kind of talk in your head is a thought. Okay, so we have a few hands too, all right? How many people think that mental agony is behavior? Pardon?
Maybe it's a product.
A product of behavior, okay.
Sometimes.
Okay, good, yes?
Could you explain the difference between like behavior / thought /
Good for you. I mean, so that's a key question. So, what is the difference? So we have thoughts. We have feelings. And we have behaviors. Okay. So, what are examples of agonizing thoughts, for example? Okay, this gentleman mentioned that, am I going to be impressive enough? Am I going to fit in a social situation? Can I have meaningful relationships? These are thoughts. What did these thoughts cause him? What feeling did they produce? Can you tell me what feelings do these thoughts cause in you?
Sadness.
Sadness.
Stress.
Do you know?
Situation.
So when you're in a situation, you have these thoughts whether you can actually, can I really have meaningful relationships? Am I ever going to be able to be in a meaningful relationship? Am I going to be impressive or fit in? When these thoughts are in your head, what feelings do you feel?
I would imagine they feel lost.
Pardon?
I would imagine they feel lost.
I have to come closer to you.
I'm sorry, my voice is not today. I would imagine they feel lost.
Feeling lost. feeling or is that a thought?
How much? That's right.
That's a thought, feeling like your mind is telling you I'm lost. What is the feeling of being lost? What does it trigger? Fear. Good. Yes, that's a feeling. Triggers fear. What else? Anybody else can guess what other feelings that can be triggered? Yes.
You can feel empty.
Feel empty? Okay. So we have here, we say thoughts of loss or being lost. Let's say lost. We have thoughts of being judged, right? We have feelings of fear. We have feelings of, what did you just say? Emptiness, yes.
Would anxiety and stress go there?
Yes. So anxiety,
Maybe sadness.
sadness, excellent. These are all thoughts, right? Sorry, feelings. These are all feelings. So these are thoughts. Now, any behaviors that can cause mental agony? Yes.
Isolation. Like being isolated.
If you isolate yourself, so you withdraw,
Yeah.
that can cause mental agony.
Yeah.
Okay, in the form of what?
I guess like just not being social with other people.
Okay, so you are not social and you're isolating yourself. What does this bring? Any certain thoughts in your mind or feelings in your heart?
I guess the loneliness thing that they're talking about.
Okay, so when you isolate yourself, you feel lonely. And these feelings of loneliness, what thoughts do they trigger in your head?
I guess like you don't fit in.
Exactly. So you feel you're not fitting in, and that makes you think that what?
They should be here.
You shouldn't be here. So it can be also serious enough to the point that you don't want to be around in this world. Yes. Okay. So maybe somehow suicidal thoughts. So behaviors like isolation, isolating yourself. Okay, feeling lonely. As a result of that, you have feelings of loneliness. And as a result of that, you have thoughts that you shouldn't exist in this world, right? Suicidal thoughts. Right? And now, if you have these suicidal thoughts, is it possible that these thoughts can also trigger certain behaviors? What? Mm-hmm.
Self-harm.
Self-harm, exactly, yes. Okay. Please, you were going to say something.
Loneliness, depression.
Loneliness, depression is another feeling, of course, which is also equal to sadness. Although this is a rough correlation, but there's a lot more to depression than just feeling sadness. So, like we see here, that if we really want to cope with agony, with emotional agony could be from thoughts, could be from feelings, it could be from behaviors. And sometimes we're only aware of one of these things. I feel sad. But we're not aware of what behaviors make me sad, what thoughts make me sad. And so there is this triangle that's important between thoughts, feelings, and behaviors. And this is a two-way street, so they all affect each other. So if you have a maladaptive thought, and you're aware of it, not good enough, for example, a bad person, that's a thought. That will make you feel either maybe a sense of anger or a sense of sadness, a sense of shame, then that can lead to behaviors of, I'm not good enough, I'm not going to perform, I'm not going to do, I'm not going to mingle with people, I'm going to isolate myself. Or I'm going to not exist in this world, and why don't I just commit suicide, and then you can have suicidal behaviors. So behaviors can lead to thoughts. Thoughts can lead to behaviors. Thoughts can lead to feelings. Feelings can lead to behaviors. So this is a triangle that is like a vicious cycle, and it goes both ways. If we are aware of a situation where we have mental agony because we have thoughts that we can't help, and these thoughts are causing us mental agony, can we ask ourselves the question, where are these thoughts coming from? What am I feeling exactly? And explore. And so if you find the feeling, you can say, well, what am I doing as a result of these thoughts and these feelings? What am I doing that perpetuates them? And see how that leads to a behavior. And the same thing if you start with a thought, a feeling, a behavior. Explore the other two. They all come from each other and potentiate each other. And to cope, simply speaking, we need to be first aware of the presence of these factors. Then, if we break the cycle somehow, you can either change your maladaptive thoughts by challenging them, asking yourself, are they valid? What's the evidence that I'm really not wanted, or that I'm not good enough? And if you replace the maladaptive thoughts with adaptive thoughts, automatically the feelings will change and the behavior will change. And so on, whatever you're aware of. If you're aware of a behavior, challenge the thoughts and the feelings. If you're aware of thoughts, challenge the behavior and the feelings. Challenge how it affects the behavior and the feelings, and so on. If you have a behavior, same thing, challenge it and see how it affects the thoughts and the behavior. So none of us is immune of not having mental agony, whether it's within what's accepted as within normal limits. You are still able to function. You're able to go to school, you're able to sit for exams, you're able to succeed, but you are really struggling on the inside emotionally. All the way to losing function. You're not able to go to school, you're not able to focus, you're not able to have energy or motivation, your sleep is disturbed, your appetite is disturbed, or isolating yourself from the community, you're having panic attacks if you're in situations. Now, of course, this is simply putting it. Our behaviors, thoughts, and moods are very complicated. You need not to be ashamed of seeking help at all. This is the bottom line, is you're not alone. All of us suffer at any social status, at any racial group. Human beings in general are subject to struggle emotionally and suffering. We all suffer the same way, whether we're from Saudi Arabia, or we're from Malta, or we're from Russia. The feelings, the agony, the thoughts, the behaviors are exactly the same. The differences in people are minimal. Humans are almost 99% identical in everything. Our cultures expose us to some differentiation, probably 1%. And we tend to hang on to this 1% difference and see whether we actually fit in or not, or are we right or not, are we wrong or not. So I think that's probably enough for today. I hope this can give you some tips on at at least the first steps towards learning how to cope. Any questions?
Yeah. Okay. Perfect. So thank you.
You're welcome.
Lydia. Oh, no worries. All right. So I'm just going to filter through some of the questions that we got online, but I wanted to open it up to see if. Yes. Forum is also on Facebook. Thank you, Harun. And then if anybody wants to start us off with a question from the audience, I'm gonna. Okay. Go ahead, Armin.
Okay. Yeah. So I had a question for Dr. Javed. Earlier you mentioned that like it's possible to have like an addiction to cannabis, although like a lot of users of cannabis will argue like you can't be addicted to weed, and that's why they use it. So how do you address that?
So the first thing in addiction is denial, right? People say we're not addicted.
Right.
10% of people, yes.
Can you repeat the question, please?
So his question was addiction to cannabis, and there's a lot of people who say that you cannot get addicted to cannabis. So why is it that addiction to cannabis is something that is considered? My first thought to that was that denial is definitely a big factor. And of course, the second thing is that it really depends on how you define addiction. If you consider that, so there are some people who consider addiction not to happen unless you go through withdrawals, right? Physical withdrawals. So alcohol can cause physical withdrawals. There's some medications you stop taking them, they can cause physical withdrawals. Cannabis, a lot of people say, does not cause physical withdrawals. So that's how they would define that. But cannabis does cause physical withdrawals. Cannabis does cause psychological withdrawals. So regardless of how you define it, cannabis does cause an addiction. 10% of people who will use cannabis will actually get themselves into troubles and will not be able to stop using. They will have, it'll have an effect on their academics, it'll have an effect on their relationships, it'll have an effect on their finances, it'll have an effect on their own state of health, on their mental health, on their physical well-being, on how they eat, how they take care of themselves. Addiction, big problem.
And I'm going to take one question from the forum, and it's actually for you, Dr. Javed. So the question is, if you're trying to break an addiction, how would you go about explaining to your parents or close people in your life that it isn't a moral issue or an issue that you just want to use drugs for fun, but rather it's a deeper struggle? Do you have any advice on that?
That's a loaded question.
For sure, yeah.
And if both of you have any answers also, please let me know. So I think the first thing to think about is, so here's the first thing to think about, and that is that your inability to, and once again, this is not professional advice, you should seek professional advice, but considering the bigger problem is your inability to talk to other people and explain that you're having difficulties. That's the basic kind of a problem. Addiction, or what is not addiction, is something that comes later on. Why is it a reason that your relationship with your close ones is such that you cannot talk to them about how deeply you're struggling? It's a big problem. So addiction is the icing on a bad cake. It's there's a lot of other stuff there that needs to be resolved. That deeper struggle that you're talking about, that might be present, that might be causing the addiction, is something to definitely process. So there are people who, so the first step would be, please get into psychotherapy. Talk to people, talk to a professional about how you can start untangling this dilemma.
Yeah, I agree with Dr. Javed that if the reason why you are asking the question is because you feel that there is some barrier between you and your parents, you're unable to break the news to them honestly and openly, then it is the addiction part of some dynamics that had happened or you grew up with your family. Are they going to judge you? Are they going to ostracize you? Are they going to demean you or blame you for it? If this actually is the case, if you feel like you deserve an applaud to recognize that you have an issue of addiction, and to the point that you actually want help and you want your parents engaged. This is really excellent. But if you feel like you're going to be judged and not supported, it may not be the time to tell your parents right away. It may be that you need to seek help from your school counselor first, strengthen yourself and of course, seek help for the addiction itself. And when you feel that you are emotionally strong enough and you do want to tell your parents, to communicate with them and tell them what the problem is and bear the consequences strongly. I know they're going to judge me, and I know they're not going to approve I know they're going to think that I'm not the kid they thought I was. But it's okay. I'm going to deal with it. This is my life. They need to know. They have the right to know, and their reaction belongs to them, not to me. It's their issue to deal with. And so your self-esteem is important. Okay?
Go ahead. So, Dr. Okayli, you said about breaking the cycle of maladaptive thoughts. So I know this is probably you have to do counseling sessions to learn how to break the cycle. But what are some tips you could give us for breaking or starting to break the maladaptive thoughts?
I think it's a great question. The first thing is to recognize them, because a lot of the time they're in our head and we're just so used to them. We just talk this self-deprecating talk, and we're not even aware that it's there and it's affecting our mood and function. We just take it for granted that we are this way. So the first step is to recognize these thoughts and challenge them. I'm not good enough. Is that true? What's the evidence? What is it? Who am I? What do I do that's bad? Is this all I do? Do I do anything that's good? And list them. List your qualities. List who you are. And you don't need to go to psychotherapy to break that cycle all the time. There are many resources now that you all have online that can teach you how to do that. This is called cognitive behavioral therapy, or CBT. And it's key in breaking that cycle. And there are so many resources and apps online that can help you. Just go to it and do self-learning. And if of course, it's very beneficial to actually talk to a therapist and learn more formally how to do that. And it's going to be probably more effective, but it doesn't, if you don't have that resource, you can't just continue to struggle. You have free resources online.
We have a question on the forum, so this could be for anyone. In a situation where you aren't sure if you have a mental illness, but you feel as you have many symptoms, what is the best way of approaching the situation to find out whether or not you have an issue and you need help?
I guess if you are a UT student or if you go to any school, usually, for example, UT has a health science center, offer counseling and even psychiatrists here. So first thing will be to talk to either therapist or a psychiatrist. If they don't want to see psychiatrists, they can talk to a family doctor. There's some very simple screening questionnaire family doctors, internal medicine doctors use nowadays. They are simple but sophisticated, and they're good screening questions. So I would actually see a therapist, or if you don't want to see a psychiatrist, you can just talk to your primary care physician. There are some specific, almost everything is available online now, like you said, doctor. So unfortunately, I think the question is, which one applied to this particular case? And I think in general, talking to a doctor or a therapist would be the first step. Majority of the time, we are treating people only if they're having severe functional problems. So if you are able to see someone, it does not necessarily mean that you're going to be placed on medicine or given a serious diagnosis. You can have ADHD, you can have depression, and not take any medicine or get any treatment unless it's causing serious functional impairment. Okay.
Assalamu'alaikum. Thank you for coming out here. So I have a question to any of you. So we see these disorders and the chaos or disorder that comes within oneself, and we see religion or faith trying to break order out of this disorder. But we also see these examples where like this combination of faith, religion, and physical or mental chaos or disorder comes together, and there is this whole another level of destruction and chaos. So how do you see this conflict?
So here's the thing. As we grow, as we mature, we start having the ability to put multiple points of view at the same time in our mind, right? So meaning that it's a developmental stage when you are, when all of us start learning that one phenomena can have a biological component to it, it can have a psychological component to it, it can have a social component to it, it could have a spiritual component to it. It's just one phenomenon. There could be so many different things going on. And that is part of the challenge of knowing yourself, in which you figure out what is coming from what and how do I treat what.
I think that